from Vicky. Hi, Vicky. She wants to say, if you have a heart attack, what are the things you must make sure to ask the doctor, and are there any tests you should request?
You're in the throes of having a heart attack. When you get there, the most important thing that you do is you communicate. You tell the doctors how you feel. And if you know that something is wrong, then you don't leave that emergency room until it has been fully addressed. And the tests, there are 3 specific things that we use to make a diagnosis of an acute heart attack. And one, of course, is the symptoms, the classic type of symptoms. But women can have different sorts of symptoms, and we can talk a little bit more about that later too. But the other is a blood test called checking for the enzyme called troponin. And if the doctor checks the troponin level and it's elevated, then that indicates that there is some damage to the heart muscle, and that must be further addressed. The third test, of course, is the electrocardiogram, and that's the tracings, the electrical tracings of the heart, where we can see if there are specific findings that show that there's what we call a STEMI, which means a big heart attack, an ST elevation MI, or if it's a non-STEMI, that's a little harder to figure out sometimes because the findings aren't quite so specific. They can be a little more variable. But if those 3 things, symptoms of concern, elevated troponins, and an abnormal electrocardiogram, you really only need 2 out of those 3, you got a heart attack. You need to stay in that hospital and you need to get treated appropriately.